Good evening, all, and welcome to another session of Stroke Support India. Just a quick introduction to what we are for others who might be seeing the video later. We are a stroke support group in India with a mission of raising stroke awareness and helping the affected and their families, as part of which we have occasionally sessions similar to what we are going to have today. And everyone is welcome to join our groups. The links will be given in the video description. You can use that to join in. And we, as I said, frequently have sessions from stroke affected, from experts on various aspects of stroke and aphasia. So today I'm glad to have Dr. Jenis Bhalavat with me. Just a quick introduction to her, and then I will hand over to her. She has been practicing physiotherapy for the last about 14 years with a Bachelor in Physiotherapy and postgraduate Diploma in Nutrition and Dietetics. And she's also a PNF practitioner and a Mulligan practitioner, something probably we'll talk about a bit as we go along, and is an expert in stroke rehab, spine pain, and neurophysiotherapy, and has strong experience in Tele-rehab, which is, I think, catching up now, and I think is also going to be the way forward. So I thought it would be a good idea to have her experiences, have her share her thoughts, experiences for everyone of the stroke community. So with that small introduction, Dr. Jenis, it is over to you, and we'll take it further. We'll have a small chat maybe later on after we are finished with the presentation, and over to you now. Thank you very much.
Yeah. Hello, everyone. Thanks for joining. I'm Dr. Jenis, and thank you, Hardeep ji, for this invitation and opportunity. So let's talk about tele-rehab. I'll start my screen sharing. Just a second. Can everyone see the whole screen?
Yes, ma'am.
Yeah. So let's talk about tele-rehab. First of all, I'll talk about why of tele-rehab. Why is this picking up? Why is this important rather than what it can provide? So it provides a continuous support. Say after 6 months of rehab, a year of rehab, or 2 years of rehab, you really get tired of like how long I have to continue with my exercises. Can I get something where I can get a complete support? मुझे पूरा support मिल सकता है, मैं पूरा अच्छे से कर सकता हूँ, या ऐसा कुछ जहाँ पे मुझे जब जरूरत पड़े तब मैं किसी से कंसल्ट करूँ, मैं एक फिजियो से कंसल्ट करूँ जब मुझे जरूरत पड़े, रेस्ट में अपनी एक्सरसाइजेस कर सकता हूँ अपने आप से. So this is how continuous support tele-rehab provide करता है. Then costing. I can just imagine a young person जो ऑफिस जा रहा है, might be a 48-year-old male जो ऑफिस जा रहा है, उसको all of a sudden paralysis होता है and वो bed bound हो जाता है. He has to bear the paralysis का treatment cost. Insurance कब तक काम करेगा? He has to bear the family expenses. कहाँ तक कब तक savings काम करेंगे? So this is one option. This is one portal जहाँ पे उसको एक reduced cost पे good therapy provide हो सकती है. Time efficacy, it definitely it's very useful जब आप अपने time के हिसाब से physiotherapy sessions कर सकते हो. There are times जब आप बहुत ज्यादा एक्टिव नहीं हो या बहुत lethargic हो and the physio really can't keep up with the time support, time duration. So ये वो टाइम एफिकेसी है जब आपको might be 7 o'clock in the evening अगर थेरेपी सेशन चाहिए तो you can have actually a quick therapy session. Then it is the research says that the research that was done during COVID times, this is what evolved in India during COVID, कि उस टाइम जो भी रिसर्च हुए, उस टाइम जो भी प्रैक्टिशनर्स का रिसर्च आया, उनका जो इवैल्यूएशन आया कि यस दिस इज अ वेरी गुड ऑप्शन जहाँ पे होम रिहैब नहीं कर पा रहे हैं पेशेंट, जहाँ पे पेशेंट्स बोल रहे हैं कि नहीं हमें नहीं करना है होम रिहैब, आई वी वांट टू डू इट बाय आवरसेल्व्स नहीं कर सकते हैं, वहां पे कुछ सपोर्ट चाहिए रहता है। कुछ पेशेंट्स ऐसे होते हैं जिनको एक कंफर्टेबल सराउंडिंग चाहिए। होता है बहुत बार जब वो क्लिनिक जाते हैं तो क्लिनिक के अंदर नहीं कर पाते हैं बराबर से एक्सरसाइज, कॉन्शियस होते हैं कि अरे मेरा हाथ नहीं हिल रहा है, मेरा पैर नहीं हिला पा रहा, बहुत कॉन्शियस होते हैं। सो दिस कैन हेल्प देम विद दैट। So this is a very big advantage according to the research. This is completely research based point. कि tele-rehab brings healthcare to the patient. पेशेंट नहीं जा रहा है फिजियो के पास, पेशेंट नहीं अवेल कर रहा है फिजियोथेरेपिस्ट, टेली रिहैब आ रहा है उनके पास, उनको एक सर्विस, एक अपॉर्चुनिटी मिल रही है जहाँ पे वो अपनी हेल्थ के बारे में सोच सकते हैं। Then another the same thing, it's convenient around the patient schedule. Then obviously it is useful. Just a second. Yeah, obviously it is very useful when patients are advised to do a long-term physiotherapy. लेकिन नहीं ऑप्शंस नहीं है उनके पास। आई हैव सीन मेनी पेशेंट्स दे आर लाइक मैम वी रियली वांट टू डू बट नहीं वी कांट रियली अफोर्ड। So this is one thing which is really very useful. Then there is another part. Yeah, there is another part जहाँ पे कुछ एरियाज होते हैं रूरल एरियाज में जहाँ पे इंटरनेट कनेक्टिविटी इजी नहीं होती है। सो दिस इज नॉट दी ओनली फॉर्मेट कि हम वीडियो कॉल से फिजियोथेरेपी करा रहे हैं, वीडियो कॉल से एक्सरसाइजेस कर रहे हैं। आई हैव बीन कंसल्टिंग पेशेंट और ओवर द फोन, फोन पे उनका मैं असेसमेंट ले रही हूँ, फोन पे उनसे बात कर रही हूँ, फोन फिर मैं अपना रिकॉर्ड करती हूँ एक्सरसाइज वीडियो और उनको सेंड करती हूँ कि अभी आप ये ऐसा करो। यस, वहां पे एक डाउट होता है कि इफ द पेशेंट इज डूइंग करेक्टली और नॉट, वो पेशेंट की रिस्पॉन्सिबिलिटी होती है कि वो एक्सरसाइज का जो उसका सेशन घर पे कर रहा है उसका एक रिकॉर्डिंग डॉक्टर को भेजे, फिजियो को भेजे। So this is how a communication is established. A telecommunication is established between the patient and the physiotherapist, not only via video calls but other means also. So how is this session ideally goes about? It's a 30-minute session, can extend up to 45 minutes. And after that, ideally the patient is really not attentive or is tired. Then what consists in a session? Tele-rehab is not only about physiotherapy, it's a holistic kind of ट्रीटमेंट। यहाँ पे सिर्फ पेशेंट ने हमें हाथ मूवमेंट सिखा दिए या पेन को ट्रीट करना सिखा दिया, नहीं, वैसा नहीं होता है। इट्स ऑल अबाउट कार्डियो ट्रेनिंग ऑल्सो। इट्स लाइक अगर मैं आपको बोलूँ कि आप चलो 5 मिनट्स रोड पे चलो, पैरालाइज पेशेंट आफ्टर अ लॉन्ग टाइम तो नहीं चल पाता है, वो थक जाते हैं। So this is how a cardio or aerobic training would be helpful. Then a health coaching. Health coaching would be during prolonged duration के बाद पेशेंट्स डिप्रेस्ड हो जाते हैं, एक टाइम के बाद might be 2 years, 3 years, 4 years, 5 years, they really get depressed कि why I'm having this. पेशेंट एक डिप्रेशन में चला जाता है, वहां पे एक हेल्थ कोचिंग की जरूरत पड़ती है। देन योगा, योगा में ब्रीदिंग एक्सरसाइजेस है और बहुत सारी अदर एक्सरसाइजेस है विच आर रियली हेल्पफुल। एंड रिसर्च सेज दैट वो स्पैस्टिसिटी कम करता है, वो पेन जो स्ट्रोक रिकवरी के टाइम जो पेन होता है, इट हेल्प्स यू टू ओवरकम दैट। दैट कंसल्टेशंस होते हैं। Then one of the very important thing जो हम OPD में या home visits में नहीं कर पाते हैं, that is prognosis evaluation. यहाँ पे सारे physiotherapy sessions जो होते हैं, those are recorded with the patient consent of course. So जब patient को हम बताते हैं कि okay fine, this is what you were a week back, this is what you are now. Patient को एक visual feedback मिलता है, एक opportunity मिलती है आगे बढ़ने के लिए. So very good pointer for a prognosis evaluation. Obviously, the privacy is maintained, the sessions are recorded, which is really very helpful. So how the session goes on, there is this limit of a session where the connectivity is checked कि yes connectivity है या नहीं, patient को वीडियो बराबर दिख रहा है या नहीं, फिजियो का इंट्रोडक्शन होता है, पेशेंट कंसेंट साइन करते हैं हम, जहाँ पे पेशेंट से कंसेंट लिया जाता है उनके सेशंस रिकॉर्ड करने के लिए, और उनकी सारी हिस्ट्री डिटेल्स हमारे पास रहती है. जैसे आप इन क्लिनिक में असेसमेंट होता है, जैसे आपका होम केयर फिजियोथेरेपी सेशंस में असेसमेंट होता है, वैसे ही पूरा असेसमेंट लिया जाता है, सेम क्वेश्चनिंग होता है, सेम पुराने रिपोर्ट्स देखे जाते हैं, वाटर ट्रीटमेंट्स आर टेकन. फिर हम पेशेंट की पोजिशनिंग देखते हैं कि पेशेंट कंप्लीटली सपोर्टेड है या नहीं ड्यूरिंग द एक्सरसाइज, उसका मोबाइल पोजिशनिंग कि पेशेंट हम जो एक्सरसाइज डेमोन्स्ट्रेट कर रहे हैं वो देख पा रहा है या नहीं, एंड पेशेंट पूरा पोजिशन है या नहीं, उनका सपोर्ट उनको मिल रहा है या नहीं. लाइक patient has to be seated comfortably. They shouldn't lose their balance while doing exercises. Probably a corner of a house or something, which is really very comfortable for the patient. Then, जब therapy session चल रही रहती है, तब हम patient से continuous feedback लेते हैं. Are you able to do? Is there any problem? It's the same as the home sessions. Then, जो सेशन होते हैं वो एक गोल के ऊपर होता है. होम सेशन और टेली-रिहैब सेशन का दिस इज द वन मेजर डिफरेंस इज कि व्हेन यू गो फॉर अ होम सेशन आप हैंड मूवमेंट्स करोगे, आप लेग मूवमेंट्स करोगे, there might be many repetitive exercises that has to be done, those you can do on your own also. जबकि टेली-रिहैब सेशन में there is one fixed goal. Okay, now today we'll try to move your shoulder or your upper limb by 20 degree from flexion to between abduction, यानी यहाँ से यहाँ तक लेकर जाएंगे. So this is how the sessions are planned. Patients need to follow the instruction. This is one place जहाँ पे the patient या उनके caregiver they should understand कि physio क्या बोलना चाह रहा है. By understanding I mean पेशेंट का कॉग्निशन लेवल थोड़ा अच्छा चाहिए. इफ अगर पेशेंट बराबर से देख नहीं पा रहा है, उनको डिप्लोपिया है या उनको सुनने में प्रॉब्लम हो रही है, देन देयर हैज टू बी अ केयर गिवर बिसाइड देम जो उनको समझा पाए कि डॉक्टर ये कहना चाह रहे हैं. एंड ऑब्वियसली एट द एंड इट्स अबाउट द अचीवमेंट. आपने एक सेशन में कितना अचीव किया है, आप नेक्स्ट सेशन में कितना अचीव करना चाह रहे हो, और आपका होम प्रोटोकॉल आप कितने अच्छे से फॉलो कर रहे हो. दिस इज व्हाट इट्स ऑल अबाउट. So these are my reviews that I had, and these are various researches that you can see in the slide later on. So I'll just stop my screen share. Yes. Now, I'll show you a few exercises so I had done with the patient. Can everyone see the exercise? Are you able to see the video?
Yes, ma'am.
Yeah. So ये एक एक्सरसाइज है जब मैं पेशेंट को बता रही थी कि दिस इज हाउ रॉन्गली द हैंड यू आर मूविंग, एंड आपको ये एक्टिव असिस्टेड मूवमेंट करनी है विद द हेल्प ऑफ अ रॉड. Then I'll show you again. Stop the screen share. Then there is another exercise जहाँ पे patient को मैंने video भेजा था. The patient wasn't cognitively enabled कि she'll follow my instructions, and उनको मैंने मेरा video भेजा था कि this is how you have to do the exercise, and then she followed up. She was an old lady. This was during COVID times. यहाँ पे she is wearing the band, though she is doing trick movements. This is what I call target based exercise, जहाँ पे उनको एक टारगेट दिया जाता है जो उनके फंक्शनल एक्टिविटी से रिलेटेड. फंक्शनल एक्टिविटीज आर दोज एक्टिविटीज जो आपके डेली रूटीन में आप करते हो, जो हैंड मूवमेंट्स आप डेली मूवमेंट एक्टिविटी में करते हो. So this can be functional task based exercise that she has to accomplish. These are touching the ball with this hand. This is all about physiotherapy tele-rehab session. And yes, I use various techniques like PNF. PNF is proprioceptive neuromuscular facilitation, जहाँ पे स्ट्रोक में आपके जो प्रोप्रियोसेप्टर्स होते हैं, जॉइंट में स्पेसिफिक नर्व्स होते हैं, नर्व एंडिंग्स होते हैं जो आपको जॉइंट पोजीशन सेंस देते हैं. सो देयर आर स्पेसिफिक मूवमेंट्स जो आपको हेल्प करते हैं. I add it with my Mulligan's movement. Mulligan's are mainly for pain. जब shoulder pain होता है, elbow pain होता है, so there are various glides, self-assisted glides होते हैं जो patients खुद से कर सकते हैं. So this is one. And task-specific approaches, as I showed in the video, patient को एक task दिया जाता है उनके functional activities related, and उनको वो एक accomplish करना रहता है. Various stimulatory techniques use करते हैं. Self play stimulatory techniques होते हैं, उसमें अलग अलग approach है, Ruth approach है. There are various approaches which I teach my patients and they can do accordingly. Then this is what all about tele-rehab. Anyone wants to ask anything can ask.
Yes, anyone. I'm seeing a couple of people, Anil and Sridharji. If you want to ask anyone or share your experiences, you can unmute. Or I have some questions, whichever way. You can unmute yourself and ask, and we can take it further from there.
Oh, ma'am, in tele-rehab, what is the video, this thing that is required, sir? Like, it can be done on what platform, like WhatsApp video call or any other special requirements for having a tele-rehab?
No, there are no special requirements. Like we are having a Zoom session now. It's the same session. You
So
are
will
seeing.
it be like video and all? Will it be okay, like the alignment and the focus, everything? Will it not be any issues while conducting a tele-rehab?
No, there are no issues. See, that's what I said. It's goal specific. Now I have assessed the patient. I know where is the problem, what the patient is having an issue. I'll tell the patient, okay, next session, I want you to do your leg movements in standing. I'm going to do that. So you have to find a place in your house, which is a corner. You are supported well. You are with your walker or a cane and able to do those exercises. So the mobile would be, it can be accessed by mobile also. It's not necessary you need to have a laptop. It's the same video call. So this is how it happens. So patient will make themselves accommodated accordingly. If the patient is having exercises for the elbow. The next session, if I say, okay, fine, next year we are going to work on your elbow according to your complaints. So I'll ask them to be seated on a table which is really at your chest length, and you are able to move your elbow, and the mobile would be placed accordingly. So this is how the information is passed on to the patient.
Okay.
See, I
Any-
would imagine a caregiver would be required usually to, for example, uh, position the patient, position the, let's say, the mobile device. It cannot be is only on the basis of, let's say, patient interacting directly with the therapist. There would be a caregiver or someone supporting the patient in between, right?
Okay.
Not, yeah, not always. If the patient is cognitively stable, it's just a movement issue the patient is facing, then there hasn't been an issue as such. If the patient is cognitively stable, there hasn't been an issue. Not much of caregiver support was required as such. I have to selectively select the patients. I have to give them exercises in a way where if the patient is not able to avail the caregiver support, the exercises has to be done in that way. See, during my physio rehab session, even if we are doing home therapy in home visit, it has to be maximum input from the patient side. I really, for me at least, I'm telling my experience, I really don't touch the patient much. It's what the patient has to do exercises on their own. If the patient is losing balance, the patient has to learn to gain balance. The patient has to um, अंडरस्टैंड उनको वो पता होना चाहिए कि उनकी बॉडी में कितनी स्ट्रेंथ है और वो कितना लेवल तक खुद की बॉडी को स्ट्रेन कर सकते हैं. वो जो एक अजम्पशन होती है खुद के बॉडी की, वो पेशेंट को आनी चाहिए, वो उनको सीखना है. So जो होम रिहैब होता है इट्स द सेम वे इट हैपेंस इन टेली रिहैब. द ओनली डिफरेंस इज होम रिहैब में फिजियो रहता है, सो पेशेंट को साइकोलॉजिकली एक सपोर्ट है कि देयर इज समवन स्टैंडिंग. टेली रिहैब में पेशेंट इज स्टैंडर्ड इन अ गार्डेड वे, दिस इज वन थिंग. सेकेंडली, जो गैजेट्स का प्लेसमेंट आप बोल रहे हो, इट इज रियली वेरी इजी. यू कैन ट्राई मोबाइल स्टैंड ले लिया, उसके ऊपर रख लिया, सो not an issue. For those things, caregiver support is not required.
One more thing. Like when the physiotherapy is going on by tele-rehab and the person is doing wrongly, are there any chances of risking an injury?
No. Wrongly would be wrong exercises. The exercises, what I say, are really very easy. And see, they are not large movements. They are small movements which are to be done in tele-rehab. The technique of treating the patient is a bit different than what you see in home rehab and inpatient rehab. OPD, sorry. So the technique is of treating is different. It's like if the patient is standing and doing balance exercise, for example, this is what I guess your concern. I would essentially make the patient stand with a support, a walker or something, near a table or a guarded place where person will do small exercise, a small movement of taking weight on one limb, on the affected limb, a weight bearing on the affected limb. How the weight bearing on the affected limb would be, there are various methods. The foot would be stepped forward and weight bearing would be there. The foot would be stepped aside, like the broad base of support, and weight bearing would be there. Then the foot person will stand in a normal stance, lift the other leg, and do one hip squat with the help of a walker and the support. So there are very less chances of injury, and obviously with assessment there are only those patients who has got good amount of tone, might be grade 2 and above. are fit for physiotherapy in tele-rehab. Hypotonia, I would really suggest. For hypotonic patient, I really ask them to go for home therapy if it's possible. And if not possible, they are in a rural area where no facilities are there. Uh, a caregiver support is required for cases of hypotonia. So it really depends upon case to case how it goes.
Ma'am, what is the tone? This thing. What is the? I I assume that it is given on a scale of 5. What is the tone?
Tone. See, when you have a stroke, uh, initially there would be any limb movement. The muscles won't be responding to anything. So we call it as a tone. When the tone is 0, it's called hypotonia. But now, gradually, as the day passes, might be a week or a two, the muscles start reacting to the movements. The muscle starts gaining some strength. Some muscle fibers get activated, I would say, and that we call starting a tone. That is normal tone. But in stroke, what happens is the tone increases unnaturally and converts into spasticity. Spasticity is excessive tone, hypertonia we call it. It's a medical term. We call it as hypertonia, where there is so much of movement, so much of muscle contraction. The patient is not able to move the limb, and it happens in stroke. So we aim not to increase the tone to an extent that it's catch and release or complete resistance. There are various grades of tone. So according to that grade, the tone is assessed. Like catch and release is there. There's complete resistance throughout the range. There's a resistance in 1/3 of the range. So these are the various levels of tone, various grades of tone, and accordingly it's assessed. I hope you understand. It's a complete medical thing. The tone is a medical thing.
And as you say, this is something which is assessed in the beginning as to what is the tone level or what is the hypotonia situation of the patient. And if it is, you said something like above 2, if it is above 2, then it is suitable for tele-rehab. How is that?
Generally, it is. I don't take in patients. I generally don't take below that because it's really risky.
Another question came to my mind. If there is are you having or are you seeing situations where someone is saying, let's say tele-rehab, let's say from you, but also doing a physiotherapist is coming there and he's taking physiotherapy also. Is that happening?
No, at present, no. At present, I'm in facing. I have one patient with 5-year-old stroke. Yeah, she is doing tele-rehab now. Then there are other cases also. So at present, nothing is going on, and it's okay if the patient is taking in-home and tele-rehab. It won't really much. But I can say it's really their choice. Their choice how they want to do. Yes, the method of treatment varies from physio to physio, and I will really suggest not to go for that because it will really confuse the body what way they have to do. Every physio has a different approach. So in the start of the therapy session, I really suggest if you're doing home rehab, continue with that. If you're doing tele-rehab, continue with that because every protocol, every way of treatment is different. And it really confuses the masses what way to do.
But as you mentioned, you are focusing on a specific goal and with smaller movements. The the physiotherapist may be, focusing on, let's say, grosser movements or, helping the person walk in maybe 20, 30 steps. So the two could be focusing on different aspects. Is it not possible? Or you think the physiotherapist who's there on site can also take care of the so-called the finer aspects as well? Did we lose you? You are... did we... Okay, we lost her for a minute. Okay, it got disconnected. She'll be logging in.
or it got disconnected.
Yes, yes. So as I
Um,
was saying, is it not possible, or do you think that the physiotherapist, if he is available or on site, then he can take care of all the aspects? So the tele-rehab situation will normally arise when there is uh, no physical physiotherapist present.
yeah, yeah. Yes. See, that's what I said. Tele-rehab is an option for those where physiotherapy is not easily available, where they have been doing home physiotherapy for a long time, but there isn't been much progress. See, patients keep on jumping from one physio to another to get some progress. This is a situation, this is a reality. Patients have been doing, we have been seeing patients who used to change patients physio every 6 months or something in hope of something new they'll do, a new treatment and some magical recovery will happen. So yes, tele-rehab is for also for those people also. And I won't say one is superior than another. Both are same. Home is also good. I am doing home rehab also. Home rehab is also good. Tele-rehab is also good. But then there are specifications, there are terms and conditions in everything.
Are there any laws or any regulations in India or certifications specifically focused on tele-rehab as of now?
No, no, nothing as of now.
Okay. So it is not that maybe the Physiotherapist Association has issued certain, let's say, cautions or certain, how do you say, practices, best practices for tele-rehab, something like that. As of now, nothing like that exists.
Nothing. Those were issued during COVID times, but then those were general guidelines. So there were specific guidelines that physios had to follow during rehab sessions, and that's it. There isn't any rule or regulation like that. See, physiotherapy itself in India is an unregulated occupation. It's an unregulated profession.
Is it? But I thought all those Bachelor of Physiotherapy and then empanelment with some bodies required, no? Like for doctors, it
Yes,
is
those
National
are
Medical Council.
those are state bodies. Those are Delhi Association, there's Maharashtra Association, there's Gujarat Association. Those are state associations. If I want to practice in Maharashtra, I have to get registered to their body. Those associations are there. Those are there with all medical fraternities. But yeah, physiotherapy doesn't have anything like MCI. MCI is a very strong body for medical fraternities. So those things aren't there. There is no government inclusion in physiotherapy practices as of now.
Okay.
There are certain bills and everything going on, but that's a different topic after.
Anyone else has any question? Please feel free. We are at 7:42. Yeah.
Yeah, I'll again
Ma'am,
share my contact details. Just a second. If anyone wants to connect with me. Hi, it's going to share. So this is these are the places which I generally put my exercise videos and a few suggestions on LinkedIn. This is my contact number. If anyone if you want to solve any queries or doubt, or have any issue related with your health, then definitely come in contact with me.
Fine. Another thing that I was just wondering, does it happen with you, as you said, for example, different people are trying different treatments. So someone has a specific issue in mind. Let's say hypothetically, for example, we have one such member who used to play Veena, you know,
Okay.
and now most of the movements are back, but that Veena movement is not yet back. So, are you having situations where a patient comes to you with a specific goal? Says, this is how, this is what I want. So now you evaluate me, you tell me what to expect and in how many sessions to expect.
Yes, yes, yes. There was this case, there was this female who wanted to do chopping with her fingers, with her right affected hand. And she was like, all movements are done. She was fabulously working on treadmill, fabulously doing all movements, but finger movements, was this finger movement she was trying to do. Yes, there are patients, and we do work over it. It depends again. If the patient is recovering very well, if it is not that chronic, the movements do come back. They need to have a bit of patience while doing the exercises, not during the time. It's the exercises they need to have patience. For say Veena, the patient needs to have, I guess, this movement. I don't know much about the instrument, but this is a movement that patient needs to have. So I'll train patient accordingly. The exercises would be done according to that. If all the movements have been done and the wrist movement is back, this movement is back, and if the patient wants to do this movement, it has to be trained that way. So it's not about task specific or aim specific. Eventually, all patients have to gain those small movements. Let it be Veena, non-Veena. Eventually, everyone wants to do this movement, all those movements. This they have to do. So those exercises are there. Those exercises would be taking place.
And you see a possibility that if one physiotherapist treatment has not worked, the other treatment could be more effective because he may have more experience, he may have different style of approaching the same issue. Do you see that happening? Like suppose I have take a hypothetical case. 5 years have gone, I haven't reached my objective. Is there a possibility that if I change a physiotherapist, I will have better luck?
It's not about luck. It's about every physio is different. You go to one doctor for your kidney issue. The doctor is not able to treat. You go to another doctor for your kidney issue. You will keep on changing the doctors. You'll keep on consulting unless and until you get a concrete solution for it. It's the same way with physiotherapy. You are having one problem. You had appointed. You got treated by one physio. You were 50% all right. The 50% is remaining, but you can't see recovery approaching. You change the physio, you go to another one. You change the doctor, you go to another one in a hope that that 50% would be recovered by that physio. That physio with their different sets of exercises, like every doctor suggests different medicine, every physio suggests different exercises, different methodologies. So that physio will treat you in a different way. It's the same way you change doctor for your medication, for your problems. It's the same thing happening with physiotherapy. So yeah, it takes place. And yes, there have been recoveries where one physio was doing very good. This five-year-old case case of stroke that I'm talking about. Yes, she was treated initially by a physio. Very good recovery had taken place. Everything was really good, but this hand movement weren't coming back.
Okay. And then
Yeah.
Upon change of, let's say, physiotherapist, there was an improvement, as you said.
Yeah, there are chances, yes. So it's the same thing. Like you change doctors for your medicine, for fever, whatever it is. It's the same thing with physiotherapy.
Right, right. Anyone else has any questions at the moment? We're almost at 8 a.m., 8 p.m. Anyone has any questions? And else we can close the session. Just another small question. How does the costing compare as compared to, let's say, physical session? Is it something which is?
It is less.
It is
It
less.
is comparatively less. Yeah, it is less because the sessions are half an hour. The physio doesn't have to spend time while traveling.
Meeting, yes.
When I do a home visit, I will travel 15 minutes, 20 minutes to go to the patient's house. I'll return back again. I'll spend that much of time. So the costing is definitely less.
Hmm.
It's reduced.
And have you experimented with group sessions? Let's say 5 people.
I want to do that. No, at present I'm taking individual sessions. I'm looking forward to that for group sessions. Might be if people support, then we can have one aerobic group session. Because in your Telegram group, I find people who are 2 years, 3 years post-stroke. So with them, aerobic exercises would be really helpful. So we can have one session one day with that. A live session for say around 30 minutes or something.
Okay, great. Let's keep that in mind and we'll work towards that. So no one has another question, so we can close the session. Okay. Thank you very much, Dr. Jenis, for all your inputs.
Thank you.
Very helpful, and I wish you the best, and I'm sure it will be helpful to others also going forward.
I really hope people to take this opportunity for
Right.
their Tele-rehab and for the information that they have. This is really a very good platform for all the knowledge and sharing.
Thank you. Thank you very much, all, and thanks again, Dr. Jenis. And I'm closing the meeting now. Thank you very much. Take
Thank you.
care.